All right, let's talk about something that affects millions of us, cholesterol. We're going to go way beyond the usual diet and exercise chat and really dive into the powerful medications that are designed to get those numbers under control. Let's jump right in.
You know that feeling, right? You get your lab report, and it's just this list of names and numbers. It can feel a little like trying to read another language. But honestly, getting a handle on these numbers is the very first step to understanding your heart health. So what are we actually shooting for?
Okay, so here are the goalposts. Think of this as the target we're all aiming for. For your total cholesterol, you want to be under 200. Then there's LDL. That's the one everyone calls the bad cholesterol. We want that under 100. For HDL, the good cholesterol, the hero of the story, men should be above 40, and women, you want to be above 50. And finally, triglycerides should be under 150. Keep these numbers in your head, because they're the whole reason the drugs we're about to talk about even exist.
So, to make sense of all this, here's our game plan. We'll start with the problem itself, then get to know the heavyweight champion, statins. After that, we'll explore some other key players, resins, fibrates, niacin, and ezetimibe. We'll also get real about side effects, and then wrap it all up with how you can take this info and use it.
So the actual medical term for this whole issue is hyperlipoproteinemia. Yeah, it's a mouthful, I know. It basically just means you have too many lipoproteins. Those are the little particles carrying cholesterol and triglycerides floating around in your blood. To fight this, we've got 5 main classes of drugs, and we're about to break down exactly what each one brings to the table.
First up, the main event, statins. Seriously, if you know anyone on cholesterol meds, chances are it's a statin. They are the most common, most effective drugs out there for a very good reason. So let's see how these powerhouses actually work.
So how do they do it? It's actually pretty clever. Picture your liver as a busy cholesterol factory. Okay, step 1. The statin walks in and shuts down the main production line by blocking a super important enzyme. Step 2. With production grounding to a halt, the liver looks around and realizes, hey, I'm running low on my own supply. So what does it do? Step 3. It starts pulling in LDL cholesterol, the bad stuff, from your bloodstream to restock its shelves. It's an absolutely brilliant move that literally cleans the bad cholesterol right out of your arteries.
Oh, and it doesn't stop there. Not even close. Statins are true multitaskers. Yeah, they crush LDL, but they also lower VLDL and triglycerides while giving your good HDL a nice little boost. On top of all that, they fight inflammation, help stop blood clots from forming, and just generally make your blood vessels healthier. It's this whole package deal that makes them such incredible protectors for your heart.
All right, moving on from the blockbuster statins, let's look at 2 other classes of drugs that tackle the same problem but from completely different angles. I'm talking about bile acid resins and fibrates.
These 2 could not be more different in their strategies. So, bile acid resins, they work exclusively inside your gut. They basically grab onto bile acids and don't let go so your body can't recycle them. This makes your liver go, well, I guess I have to make more bile. And to do that, it has to pull cholesterol out of your blood. Now, fibrates, on the other hand, they work inside your cells. They flip a switch that tells your body to get VLDL and triglycerides out of the blood pronto. That's why they're the top choice when high triglycerides are the main problem, not LDL.
Next up, let's bring in the specialists. Think of niacin and ezetimibe as the precision instruments in the doctor's toolkit. They each have one very specific and very important job to do.
When the mission is to raise your good HDL cholesterol, niacin is, without a doubt, the champ. Its superpower is giving those HDL levels a serious lift, and it does this by telling your fat tissue to stop breaking down, which sends a signal to the liver to chill out on making VLDL. So, if a doctor sees low HDL and wants to bring it up, niacin is often the first tool they reach for.
And now for ezetimibe. The best way to think about this one is like a bouncer at the club door of your small intestine. Its one and only job is to stand there and say, nope, you're not coming in, to the cholesterol from your food. Because it works in this really unique way, it's an amazing teammate for a statin. You get ezetimibe blocking absorption from your food, while the statin is blocking production in your liver. It's a fantastic 1-2 punch when one drug alone just isn't gutting it.
Okay, we've talked up all the amazing things these drugs can do. But let's be real. With any powerful medication, we have to talk about the potential risks. This isn't about scaring anyone, it's about making sure you're armed with all the information you need for that super important conversation with your doctor.
So let's do a quick rundown.
With statins, the big one you hear about is myopathy, which is muscle pain. It's not super common, but if it happens, you absolutely tell your doctor. For resins, since they work in the gut, you can get some GI stuff like bloating or constipation. Fibrates can sometimes cause an upset stomach, and, this is important, they can up the risk of that muscle pain if you take them with statins. And finally, niacin. Well, niacin is famous for causing a pretty intense but totally harmless flushing feeling. It's definitely something you want a heads up about.
Now, everybody, I need you to really focus on this slide for a second, because this one is a big deal. It is a non-negotiable safety rule. Statins, fibrates, and niacin should absolutely not be taken during pregnancy. This is a critical point that really just highlights why it's so important to have a constant, open conversation with your healthcare provider about everything, your health, your plans, everything, before you start or continue any medication.
Whew, okay, we have covered a ton of ground here. We've met all 5 of the major players in the world of lipid-lowering drugs, and we've seen how each one has its own unique playbook. So let's tie it all together with a nice, simple summary to make sure it all sticks.
Look, if you only remember one thing from our time together, make it this slide. This is your ultimate cheat sheet. Statins, they're the production blockers. Resins, the recycling preventers. Fibrates, they're the clearance boosters, especially for triglycerides. Niacin is your HDL booster. And ezetimibe, that's the absorption blocker. See, each one has a clear mission in this cholesterol battle.
When you boil it all down, what we've seen today is that these aren't just random pills. They are highly specific, intelligently designed tools. Each one is engineered to jump into the body's super complex lipid system at a different point, giving doctors a whole toolbox of options to help get us to a healthier place.
And that, of course, brings us to the final and really the most important question of all. With all these different strategies, all these tools, which one is the right one for you? Now, that's a question I can't answer. But what I do know is that armed with all this knowledge, it's a conversation you are now perfectly ready to have with your doctor.